Good evening. I'm Devin Allen, consultant with Black Health Matters. And tonight, I'm going to bring you an exciting webinar on the importance of prostate health, particularly in African American men. On behalf of Bristol Myers Squibb, the Metro Atlanta Coalition of Kappa Alpha Psi Fraternity Incorporated, I am delighted to bring Dr. Anthony Barnes to the screen, who will talk to you about prostate health. Dr. Barnes is a renowned and well-received and well-regarded urologist with Kaiser Permanente. Dr. Barnes, welcome.
Thanks for having me, Devin.
So, Dr. Barnes, we're going to, have a little chat about prostate health and the importance of the need to be screened for prostate. So let's get started. Are there any things you want to share about yourself, particularly about your background, what you do, how you got started in the whole area of urology?
Sure. I started my training. Actually, I did my medical school at Howard University, and actually did my urology training also with Howard. After finishing that training, I stayed on faculty with Howard University and directed the residency program for about 3 years before relocating to Atlanta. Started out with some group practices, but my passion is more for underserved communities, and so I broke off and did solo private practice from about 1998 until 2019, at which point I joined Kaiser Permanente Group because, unfortunately, the way things are going with medical practices, the solo practices, I was pretty much a dying breed when it comes to physicians. So I've been with Kaiser now for 2 years and happy to have made the move.
Congratulations. That's excellent information. Thank you for providing your background, because I think that would bode well for our listeners. So I'm just going to get into the questions. Let's start out with, what is a prostate gland and what does it do?
Well, the prostate gland, we typically, as urologists, call it the sex gland. It kind of sits between the bladder and the urethra. It's in continuity with the urethra, and it provides the nutrients or the fluid for seminal fluid. And basically, it combines with the sperm to kind of protect the sperm in its pathway towards fertilization. So it's an excretory gland that is, and that's its only purpose, is to kind of protect the sperm as it goes towards fertilization.
Excellent. Thank you. Again, that's great insight. So what are the signs and symptoms of an enlarged prostate? Either cancer-related or benign?
Oh, I'm sorry. First of all, I'd like to start by saying, sometimes people get a little bit nervous when they hear their doctor say that their prostate is enlarged. Prostatic enlargement is a pretty natural part of aging. Almost everybody's prostate's going to enlarge as they get older, so that's typical. And the symptoms that you'll see are slowing of the urinary stream, sometimes urinary frequency, and particularly at night, what we call nocturia, getting up 2 or 3 times a night. Sometimes some straining to void, or and occasionally what we call hesitancy, where you feel like you have to void, but it takes a little while to kind of get that urine out. The other symptoms would be incomplete emptying, and then occasionally having urinary tract infections. The thing that I like to stress, though, is the fact that that's pretty much a natural part of aging, and that probably 70 to 75% of people that we diagnose with prostate cancer are going to be asymptomatic. So one, don't count those symptoms as being prostate cancer, and certainly don't think that the absence of symptoms means that you shouldn't get screened or shouldn't get checked for prostate cancer.
That's great information. That's good to know, because as I, tell, particularly African American men, the need for prostate screening is really key. So that provided value information that we definitely needed, because sometimes when you run to the men's room, you think that there's an issue with your prostate, but to know that there's normalcy, that's good information to know. So, Dr. Barnes, what are the risk factors for prostate cancer, and who is at risk?
Well, talking about African Americans, we are particularly at risk. About 1 in 9 African American men will be diagnosed with prostate cancer in their lifetime. And that diagnosis comes with what I like to call a doubling rule, in that we're about 2 times more likely to be diagnosed with prostate cancer, and also twice as likely to die from that prostate cancer. Certainly, people that have a family history of prostate cancer would also be at risk, and that's not necessarily African American men, although certainly African American men with a family history, we definitely want those people to be screened.
Again, great information, particularly given that we have Kappa Alpha Psi, which is predominantly African American fraternity, engaged with us tonight. That really will help them as their members and share the information. So we truly appreciate what you just added. Let's move to the next question. Is there anything that decreases the risk of developing prostate cancer?
Well, it's hard to say. The one thing that we say a lot in medicine is that you can't beat your genetics. So certainly if someone has a significant family history, you definitely want to at least kind of put yourself in a position where you're least likely to get it. So, and it really goes to follow that it comes with things like maintaining a healthy diet, maintaining your weight, regular exercise, all these things that are kind of healthy habits in general are certainly things that can lower your risk a little bit of developing prostate cancer. But when it comes to absolutes, there really are no absolutes. And that's why we really, really stress that people should get screened when they're of the appropriate age for screening.
So when you say the appropriate age, what is the appropriate age for a male to be screened for prostate cancer?
Well, now the American Urological Association recommends screening definitely for men between the ages of 55 and 70. Certainly someone that has strong family history and what we call primary relatives, a brother, a father that have prostate cancer. We may do that screening with the blood test and the physical examination a little bit earlier in those patients, but definitely between the ages of 55 and 70, we want all men to be screened on a yearly basis.
Excellent. That's great information to know. So let's talk about the treatment options. What are the treatment options?
Well, the first thing I'd like to say before I go into treatment options is that this is a pretty highly individualized treatment when it comes to treatment choices. So that often I'll have a patient say, well, I had a friend that had prostate cancer and they didn't get what you're suggesting to me. Those treatment options rather are going to be based on the patient's age, the pathological diagnosis in terms of how aggressive that tumor appears to be, their PSA level, which is the blood test that we use to kind of screen for prostate cancer, and their general medical condition. So that those treatment options are going to be tailored towards that particular patient. So the one thing that we can kind of say in general is that a younger patient, certainly someone below the age of 60 that's in fairly good health, the first choice is going to be surgical treatment. Because when you talk about the other treatment modalities, those are treatment modalities that keep the prostate in place. So the longer that you have to live, at least by stats, the better chance is that someone's going to suggest removal of that prostate. So there's a little bit less risk of recurrence. So the first choice is going to be surgical option or radical prostatectomy. Now, there are some patients, though, that would choose not to have surgery, or for whatever reason, they may not be a good candidate for surgery. So the radiation option then would be appropriate for these patients. And there are two types basically of radiation. There's what we call external beam radiation, where the radiation oncologist puts the radiation right to the prostate in order to kill the tumor as it sits. And then there's a little bit more direct and slightly more invasive method called the seed implantation, where we implant radioactive seeds into the prostate in order to kill the tumor in situ. In addition, there can be chemotherapeutic agents and there can be what we call immunotherapy, but generally speaking, those are saved for people that have more extensive cancers, and often more applies to people that have cancer that's already spread outside the prostate gland.
Dr. Barnes, what you provided was excellent information, because it gives options, and also it lets men know, and particularly their families, some of the things that provide some comfort level. So thank you again for that great information, and it's invaluable. And let's move on. Who treats prostate cancer, and what type of support is available? Because again, an individual may have been diagnosed with cancer, but they still will need some type of support, whether it's family support, whether it's medical support, psychological support. But just talk about that. Who really treats it, and then what are some support options as well?
So generally, in terms of treatment, that first diagnosis more than likely is going to be made by your urologist. So we're the physicians that will do your prostate biopsy, that will kind of let the patient know about the results of the biopsy, and then make a decision or treatment plan based on that individual patient. Alternatively, if someone chooses, particularly if a patient chooses not to have surgery, the next step would be radiation oncology. The radiation oncologist is the person that oversees radiation therapy. Now, depending on what the patient decides, it may be a seed implant or it may be external beam radiation. The radiation oncologist will work with them to kind of make that treatment plan. That being said, the urologist, we still are in the mix there. Now, we may not be directly in the mix when you have your radiation therapy, but certainly once that radiation therapy finishes, the urologist actually, we take over that treatment and follow up that patient for at least the next 5 years to kind of monitor to make sure that they don't have a recurrence of the cancer. When it comes to hematology oncology, medical oncologists will occasionally get involved with prostate cancer patients. Usually, though, I would say that's reserved for people that have a more extensive tumor. Chemotherapeutic agents are used in prostate cancer, but that's a little more rare. We generally will not give them for primary treatment. Immunotherapy sometimes will be monitored by a medical oncologist. However, same thing. That's generally for someone that has a more extensive tumor or someone that has what we call a tumor recurrence.
You know, Dr. Barnes, I mean, as I sit here and listen to you intently and give invaluable information, it just makes me say to myself that more and more men need to be engaged, and hopefully what you provided will be invaluable and insightful to the men that are on this webinar. Let's move on. The next question I have for you is, we're going to move on and talk about clinical trials. I want to talk about clinical trials because they're truly key to understanding the various diseases that are impacting particularly the African American community. So what are clinical trials and why are they important for prostate cancer patients?
Okay, well, a clinical trial is a research study that uses human subjects, and generally they're trying to answer a question as to whether or not a treatment modality or a medication is effective. And so they'll take these subjects, they will take them through this treatment modality, and they do it actually in phases, where they first try to make sure that whatever treatment that they're studying or whatever medication that they're studying is safe. Then secondarily, they'll do a slightly larger trial where they're trying to figure out dosage and efficacy, you know, whether or not they need once a day dosing, twice a day dosing, trying to look at what kind of side effects there are and at what level the side effects come. And then on the third phase of the trial, they're usually comparing that medication or treatment modality to an established medication or treatment modality to see how efficacious it is and whether or not it's safe enough and efficacious enough to be put to market.
That's good to know, because I know that at times that we're underrepresented. When I say we, meaning African Americans, are underrepresented in clinical trials. Dr. Barnes, speaking of clinical trials, how many types of clinical trials are available in relation to prostate cancer?
There are literally hundreds of clinical trials going on presently for prostate cancer. The way to kind of find out what may be going on in your area, certainly your first one choice may be asking your physician, because often physicians are aware of clinical trials that are going on in the area. If you have a university hospital that's in the area, that's a good resource to look to and see whether or not they have clinical trials going on. On the internet, you could go to www.bmsstudyconnect.com. That's the Bristol Myers Squibb link for clinical trials, or go to clinicaltrials.gov. And that's another link that'll give you a lot of clinical trials to kind of choose from. And then you can kind of make your selection as to whether or not you want to participate, whether or not it's appropriate for you to kind of get into the study.
Yeah, and then on a more personal level, have you yourself had any patients that participate in clinical trials?
I have had patients that participated in clinical trials. Sometimes, though, and I think I can only speak for my practice when I was primarily in the African American community. Sometimes it can be a kind of a hard sell, because you can't really guarantee anything from a clinical trial. It is a chance to get on the cutting edge of something that may be efficacious, but sometimes it may be something that is not as efficacious as you want it to be. I think the thing to keep in mind, for patients to keep in mind, is that one, the possibility that it might be helpful from a personal standpoint, but also that even if it's not as efficacious as they want it to be, it's going to be helpful on an overall standpoint. And that, these studies are what we need to figure out what works and what doesn't. And I think particularly for African American men that are participating, it's good to find out, because sometimes things don't work quite as well for African Americans as they might work for other populations. And we can really kind of get that research kind of focused more towards that population and make things hopefully more efficacious overall.
Excellent. That is really excellent to know, particularly in the African American community with African American men. And then, that's a follow-up to this question. How many African American men have been a part of a clinical trial related to prostate cancer?
Well, I think certainly in relation to prostate cancer, we all know that African American men have been underrepresented. There are not enough men that are participating in these trials, so that even if we're looking at a treatment modality or we're looking at a medication that might be efficacious, we don't have as much information as we would like to have as to how efficacious they are in the African American community or even in the Latino community. So it would be great if we had more minorities participating in these clinical trials so that we can get the bigger picture as to how this works for everybody.
So then the question is, how does one get involved to participate in a clinical trial?
I think the first thing is to kind of look as to those links that I alluded to. Number one, certainly to ask your physician if a clinical trial might be right for you, and then for the individual patient to kind of do their research and figure out what that trial is doing, whether or not it's something that they would like to participate in, or whether or not the potential is there to benefit them and they feel like it might be good for them. I think a lot of it is kind of digging in yourself, kind of doing the research and kind of figuring out what you really want to do with it.
Great. Good information. Next question. Who regulates these trials?
Well, clinical trials are regulated primarily by the federal government. They're regulated by the FDA, the Food and Drug Administration, and certainly by the National Institutes of Health, the NIH. Also, clinical trials are regulated by institutional review boards. These are boards that are at that particular institution that is doing that trial, that make sure that the trial is ethical, make sure that the trial is legal and safe, and making sure that the trial protects the privacy of the patient, and particularly in terms of medical records and that kind of thing.
And that's all great information, because again, it's always about comfortability and wanting to make sure a person feels comfortable and at ease before they participate in anything in life. So thank you. How can an individual learn what type of clinical trials are right for them?
I think a lot of it is just doing your own research, kind of really understanding, particularly when it comes to prostate cancer, really understanding your diagnosis, understanding to what extent of disease that you have and what treatment options may be best for you. And a lot of it is just kind of doing that legwork and understanding your particular situation completely before you want to go ahead and participate in a clinical trial.
Having your own research helps. And I tell people all the time, Google is your best friend. Thank you. So when and how should a person determine when the time is right to participate in a clinical trial?
Well, basically, there's really no wrong time. I think from the time of diagnosis, I think the patient can go ahead and do that research and look to see if there are any clinical trials that they might be interested in, that might be beneficial to them personally, or if they just feel like they want to add to the research that we're doing to kind of help the population overall in terms of prostate cancer.
Great. Thank you. Once again, great information. So let's talk about, what is a targeted therapy?
Well, targeted therapy is something that's kind of has been developed by oncologists, where chemotherapeutic agents are specifically chosen to target certain points in a cancer cell, in a particular cancer cell. So it is basically designed to disrupt the normal function of that cancer cell and the cancer cell only, with minimal damage to normal cells. So it's gonna affect it in terms of the replication of the cell, how the cell repairs itself, how the cell multiplies, so that you can get the best response to that tumor from the medication without the side effects of killing normal cells also.
That's excellent to know, because I know when a person is stricken with cancer, they want to make sure that the cancer cells are actually taken care of versus their healthy cells. So that's excellent information. Thank you again. And lastly, what is the meaning of precision medicine and precision oncology?
Well, precision medicine is really kind of honing down a little bit more on that targeted therapy concept. So with precision medicine, not only are you looking to attack the cell, but you're looking to attack the cell as it behaves in a particular patient. And so it's taking into account that patient's metabolism and the particulars of that patient, so that you have the right therapy that's actually tailored to the cancer cell, but also, and as importantly, to that particular patient.
Is there anything else you want to add, Dr. Barnes, on the subject matter at hand before we close out?
Well, I think what I'd like to add and what I'd like to stress is that, one, prostate cancer is an important cancer in the African American community, in terms of the fact that if it is detected early, it can be treated. And over 90% of people that are screened and are detected early can be treated and will survive the cancer. So screening in general is important for detection of early health problems. Understanding what type of screening and when you have to do screening is something that I think is up to the individual, but certainly is something that a patient can discuss with their physician to figure out whether or not, particularly if someone's at high risk and has a lot of relatives with prostate cancer, they may want to do their screening a little bit early, as opposed to the 55 to 70 that's dictated. But certainly once they reach the age of 55, that yearly screening up until the age of 70 should be something that's part of their yearly habit. We know that prostate cancer is common amongst African American men, but as I stated before, the thing is that early detection definitely goes towards higher cure rates. And then lastly, I think we kind of touched on clinical trials, and the fact that clinical trials provide an opportunity for someone to perhaps get on the cutting edge or the leading edge of cancer treatment, whether it's for prostate cancer or any other disease state. And that even if in a clinical trial, it's not something that it ends up being the best treatment modality for a particular disease, it does help the overall community in terms of honing down on these treatment modalities that we can kind of find and figure out what's best for every patient.
Dr. Barnes, that was amazing. That was impactful, insightful, extremely engaging. And on behalf of Bristol Myers Squibb, the Metro Atlanta chapter of Kappa Alpha Psi, and Black Health Matters, we thank you. We hope that the information you provided tonight is impactful to our participants tonight, and we hope they walk away with some valuable information that will help them in their prostate health. Again, thank you and have a great evening.
Well, thank you for having me, and I'm certainly glad to help anytime.